Good evening, everyone. Thank you for joining us on our last program director panel for the week. I'm joined by two of my colleagues from the NMatch leadership team. My name is Fadi. I just graduated Columbus Central University, and I'm located in Miami, Florida.
My name is Shannon. I am a fourth-year medical student at Chicago Medical School at Rosalind Franklin University.
Hi, everyone. My name is Amanda Gamboa. I am a fourth-year student at Western University of Health Sciences, and I am from Los Angeles, California.
Okay, and I'll go ahead and introduce our amazing panelists for tonight. So we have Dr. Colleen Tomcik from the University of Rochester. We have Dr. Christopher Morgan from Trinity Health Grand Rapids. We have Dr. Maxwell Levy from Tulane. We have Dr. Adrienne from UCLA. And we have Dr. Asaff Harel from North Shore Long Island Jewish Neurology Residency Program at Northwell Health.
So the way that this panel will work is that each panelist will have up to 8 minutes to either talk about their program or to give any general advice to applicants. And then at the end, we will have a Q&A session that will be about 20 minutes long. And attendees, you are more than welcome to submit questions at any time, and we will be answering questions first come, first serve. So we will start with Dr. Tomcik.
Okay, kicking it off. So hi, everybody. My name is Dr. Colleen Tomcik. I am at the University of Rochester here in beautiful Rochester, New York. I did submit some slides. I think there they are. Look at that. Welcome. So just wanted to talk a few minutes about our program here at University of Rochester. Here's a view at night of Strong Memorial Hospital, which is our main teaching hospital, and some pictures of our residents doing things for fun and for learning. So next slide. So some things that I think are important for applicants to know about our program. We are a categorical program that is fully integrated with the Department of Medicine at University of Rochester. We have 8 positions per year for the adult neurology program and 3 for the child. We have extensive exposure for our PGY1 residents during your internship, including 12 weeks of inpatient general neurology and stroke neurology, as well as starting your continuity clinic as interns, which is really important for your learning and getting to know us. Our faculty are what make our program special, and their relationship with our residents is really important to them and to our residents. So we have world-class faculty in every major subspecialty, including general neurology. And you work with those people day in and day out. I'm currently on service, so I was working with our residents on the consult team today. So you really get to learn from their expertise and really benefit from the networking that our faculty have all over the world. We are known as a hub of medical education, not only for the education we provide our residents, but for how we train our residents to become educators. So we have a lot of interesting and unique educational opportunities for how we do that. I will call your attention to our single most favorite thing in our program, as voted on by the residents, is our academic half-day structure, where you are released from clinical duties every Wednesday afternoon for about 3 to 4 hours of hands-on learning, Q&A, videos, teaching sessions with our faculty. And it has been, we're in our 3rd year now, and it has been an absolute tremendous success. We have individualized mentoring, both for general career development as well as for scholarly activity. And we are really invested in helping you succeed and doing that on an individualized basis based on your needs professionally and personally. We do not have a strict requirement for research, although we do ask all of our residents to get involved with some sort of scholarly activity. But we are very open-minded about what that means. So you can get involved with basic science, clinical trials, educational research, or quality improvement research. We also have a number of global health opportunities and electives across 3 continents. that are really exciting that our residents love to talk about. And Rochester, for those of you who are not aware, is in Western New York, and New York is a pretty big state. So we are about 5 hours from New York City and Philadelphia, for those of you who are looking at us in the Middle Atlantic geographic sector. Next slide. So challenges, increasing patient volume and complexity. We are doing a lot of things for that. We are a major referral hub between New York City and Cleveland. So we have a huge catchment area. And that is great learning opportunities for our residents, but it also creates some challenges. We are tripling the size of our emergency room by 2027. And we're currently doing some things to create changes on how our inpatient services are structured. So we have a task force of residents, fellows, APPs, and faculty, along with the program leadership. And we're doing a lot of things in real time to see if we can make things better. And continuing to work on making your continuity clinic experience more educational. Rising cost of living, you can see there. I will point out the second highest rated improvement we have is our residents get a catered lunch Monday through Friday. And don't let them tell you they don't like it, because they do. So that's really nice for our residents to not have to worry about finding lunch, bringing lunch, packing lunch. Resident wellness is really important to us. We have a beautiful workroom for the residents, but we're also renovating their call room into more of a multi-purpose space. We have lots of social events. Our residents are very social and very engaged with each other and with the resident and with the faculty. So we have pretty much monthly social events and an annual resident wellness day that we did at the amusement park this year, which was fun. And our residents get up to 6 weeks of paid at 100% parental family medical leave during their 4 years of training. So that's really important for our residents to be able to do that. Next slide. And last slide. So what do we value in a neurology resident? So obviously we want people who are intelligent and have done well and are eager and excited to do neurology. But we also hold our residents to a pretty high standard. And we have the eye care values here at University of Rochester. So I have included them there, but I also included curiosity, which was one of my personal standards that I hold our residents accountable to. And we really have a very family, close-knit atmosphere here. And we really support each other, and we really love each other like family. So we would love to have any of you join our family, and I'm happy to take any questions now or at the end of the presentation. So thank you so much for having me.
Thank you. So we'll switch gears. Oh, just for all the attendees, we're also going to leave questions for the end. And if you have specific questions for a program director, make sure to note their name so that we can direct the question to them. Shannon, if you want to go ahead, we'll switch gears to Dr. Harel.
Thank you. I'm just gonna try to share my screen. Thank you for doing that. For everyone to allow me to go earlier than my scheduled time. I just had unfortunately can't stay for the whole thing. Can you guys see my my slides?
Yeah,
Okay, great. So this is I'm the program director for North Shore and LIJ, part of Northwell Health over in New York. For those of you who are not familiar with Northwell, we're the largest healthcare system in New York State, 80,000 employees or so, and North Shore LIJ is kind of where Northwell began, and now there are over 20 hospitals in New York State. We are on kind of the border between Long Island and Queens, and it's kind of nice because we're pretty close to the city, about 45 minutes or so with good traffic into the city. But then we also have outdoor space, good beaches, hiking trails, a little bit more living room than the city, if people are interested in that sort of thing. Our main hospital is North Shore University Hospital, which is tertiary academic center. that is about 800 beds. Again, that's in Long Island, kind of on the border between Long Island and Queens. It has a comprehensive stroke center, a level 4 EMU, level 1 trauma center, brain tumor unit, and has a research center on that campus. LIJ, Long Island Jewish, is located in Queens. So again, we're kind of on the border, kind of straddle the border between the two. And this is about 1,000 beds, tertiary care center as well, comprised of Long Island Jewish Hospital proper, and then the psychiatric hospital and Cohen's Children's, which is where our residents do their pediatric neurology rotations. And then we have an outpatient, a separate kind of dedicated outpatient site, which houses the faculty practice. Lots of different subspecialties, pretty much all you can think of. Every different subspecialty of neurology is pretty much represented at this site. So a lot of the outpatient electives or selectives that our residents go to happen at this location, which is a few minutes away from North Shore. So we do have these two large academic centers, really diverse part of the world. Queens is probably one of the most diverse parts. And being part of Northwell, which is a huge health system, we also get referrals from smaller hospitals in the area. So you do get a very large breadth of exposure. We have about 50 faculty members, again, subspecialists in essentially every neurology subspecialty. For those of you who don't know anything about the program, we originally had 7 residents per year. Now we grew to 9. Our growth has allowed us to make a lot of changes. One of the changes that we made over the last couple of years is that there are no more 24-hour calls. So we've gone to a fully night float system, and we've revamped the curriculum to be an X+Y schedule. So what that means is that, there is a dedicated inpatient block, and then your continuity clinic would be part of an outpatient week or 2, in which you do electives and continuity clinic as well. And we've been able to expand the continuity clinic quite a bit, more than doubling the capacity and the number of residents that go through the continuity clinic as we've grown. We've also developed new selectives in various different specialties, neuro rehab. We have a strong movement disorder selective, headache selective, so that we make sure that not only do you get the inpatient experience, we also get the outpatient experience, and especially the high yield neurology topics. And because after all, neurologists, a lot of us are outpatient neurologists at the end of the day, right? Or mainly outpatient. There are formal didactics 1 to 2 times every day. So we have them at noon for an hour at a time, or we have them in the very early in the morning, like morning report. And then, like I'm sure a lot of other programs, we do require a scholarly activity project. That does not mean that we require primary research. A lot of our residents do primary research, but really anything. And that has led to a lot of presentations, a lot of publications as well. I always like to include this because this is, feedback is really important for us. And, the feedback that we've gotten, our strengths really pretty clearly are really related to the education, the faculty, and resident interaction, the breadth of clinical exposure amongst these 2 different large hospitals in a diverse population. What we had heard last year, what people wanted more of was more elective time, more outpatient exposure, and the growth that we've had has allowed us to do that. So really that's something that we've really focused on, is the outpatient curriculum, growing that, because again, I think, variety matters, and the outpatient side of things is something that has not been as well represented classically in neurology residencies in the past. But I think that that's moving more and more towards the outpatient side of things. Of course, beyond PGY 4-year, we have internal fellowships in a number of different subspecialties. My field is neuroimmunology, so I'm very proud of the fellowship there. And then we have others on the horizon, like headache and for neuromuscular. And of course, we like to take our own half the time. It seems that residents do stay with us for fellowship. As far as benefits, salary I think is competitive with Manhattan programs, although the cost of living is lower than Manhattan. There is a good employer contribution for any retirement savings. You get 6 weeks of any kind of approved leave of absence, 100% fully paid, health insurance that's highly subsidized. We do give both a monthly meal allowance for on-call meals, but then on top of that, we do have lunches provided at noon conference by our department. There is campus housing, but it's not guaranteed. For those people that apply and then don't get it, there's a monthly stipend. And then on top of that, there's a gym that you can use, a pool and gym discounts for anything outside. We also offer funding to attend conferences, AAN membership, Continuum access, and Boards Vitals access. So, and then what are we looking for? So, I think really I agree with the last presentation. Really looking for people that are really passionate about neurology, that are utmost professionals, that are tenacious, they're hardworking, and they're compassionate. They value that patient care interaction above all else, to do the utmost for our patients. But they're curious and they want to work with us to kind of move the field forward, because I think that's how we've maintained such a dramatic forward momentum in the field of neurology, is by these, everybody kind of taking little steps, making little contributions to move the field forward. I think that is something that I look for in our residents, look for in neurologists in general. So that's so thank you for letting me share a bit about our program.
Oh, go ahead, Shannon.
All right. So Fadi, do you want to share your screen? Okay. And next we have Dr. Morgan.
Hello, everyone. Thanks for inviting me to share some about our program. I also, you guys had such very well organized presentations. I do have a slide I'll share. Oh, it just says, yeah, give me a second here. There you go. Can you guys see that? All right, great. Well, this was kind of our poster we put up at the AAN this year. But just introduce myself a little bit. I'm currently associate program director, but I had been program director of our program for 7 years, and I had started the program. We're kind of on the other side of the first 2 programs where they were kind of bigger, more inner city programs. We're a little bit smaller. We have 4 residents per year, and we're in Grand Rapids, Michigan, which is on the west side of Michigan, which we call the best side of Michigan. We really love the atmosphere in Grand Rapids. It's a very close-knit community, a lot of amazing culture here. We really value the family environment of our residency and the close-knit relationships between our faculty and our residents. I think that's probably the most important part, and what we value in candidates is how they fit with our culture. We also look a lot for residents that are medical students that have kind of some good diversity in leadership and teaching skills and humanistic qualities. We really value their personalities, and not just the research you've done, but the motivation and willingness to open up to different ideas. And so we look for just someone who fits well with the program in terms of our culture. We have these are just some highlights of our program. We are centered on resident education and wellness. We really value resident wellness. Several years ago, we created a call schedule without any 24-hour calls. So we have really good volume of patients in it, despite being somewhat smaller hospital than the previous 2 programs. West Michigan just seems to be an area for really interesting pathology. We get a lot of neuroimmunology up here, and just super interesting cases and great diversity of pathology, despite being a slightly, smaller hospital region. And we are expanding into different areas. We're regional, more towards some hospitals in the Lakeshore now, and talking about how we're going to expand there. But we also have almost every neurology subspecialty faculty in that, and we continue to expand our neurology program. We have a really unique curriculum, which I'll show you another slide on, but and some great education opportunities. We have a nice transition. We're categorical. We have a nice transition into our PGY 2 to 4 years with a boot camp that we do neuroanatomy and neuroemergencies, and some integrated didactic programs throughout the year. We have a great continuity clinic where residents get exposed to a lot of procedures and get a wide variety of subspecialties. I think being a little bit of a smaller program, we can pick and choose a good variety of patients for residents in their continuity clinics. We do have a stroke fellowship program and a palliative care fellowship program. We have one of the few neuropalliative care doctors in the country, and I think that's kind of a nice highlight. We also have a very strong neuro-ophthalmology program, and we have a level 4 epilepsy and comprehensive stroke center as well. So I think we have really nice resources in our community and in our hospital. Just the culture here is just so family oriented and a really nice place to be. I'll show you a slide on this is an innovative curriculum that we designed a couple years back. We presented at the AAN for the last couple years and gotten some interest in it, but it incorporates a lot of different aspects. We call it our humanism and resiliency curriculum, including not just neurology teaching, but kind of what you're going to do after practice, how you transition to practice, how do you look at your finances, how do you talk into a camera when you're interviewed, a lot of wellness activities we have throughout the year. We talk a lot about advocacy and leadership programs, and we've been having an elective that we are thinking of having all our residents do, looking into what really drives you, how do you find your purpose in your training and in your career. These are just some of the workshops and things we have in our curriculum related to those different topics. We've been really excited about it, and hope you guys would consider checking out our program. I think it's a pretty cool place to hang out. Grand Rapids is an amazing city with, it's got everything a big city has, but without all the traffic. So it makes it easy to get around, and you can live out in the woods, and you have a 10-minute drive to the downtown hospital. And so it's just kind of a different area. Michigan's got a lot of lakes and nature to explore as well. So, but happy to take questions at the end as well.
Thank you, Dr. Morgan.
I'm gonna step off. Nice to meet you all, and thank you again, and thank you to everybody for joining. Thank you. Sorry.
Thank you, Dr. Harel.
And next we have Dr. Levy.
All right. Hi, everybody. I've got, I've got a slide here I can bring up, but until we get that figured out, I'll just kind of talk freehand. So I'm here from Tulane University in New Orleans, Louisiana. We've got a categorical residency program. We've got 5 residents per year. New Orleans, I think, is a really fantastic place to train. It's a very fun city, lots of great food, great music. There's Mardi Gras. There's always something going on. You're not, everywhere where you go for residency, you're going to work hard. But being someplace where you're going to be able to enjoy yourself, have a lot of fun, make friends with your co-residents, I think is a really important part of the experience. But while you're here, you're going to see a lot of really great pathology. We've got a number of different training sites. Our healthcare system has gone through a little bit of a change over the past couple of years. Our main teaching hospital used to be part of a national for-profit healthcare system, and we've recently kind of spun off of them and joined a small, growing local nonprofit system, which has given us a much nicer, tighter local network to see patients within. So the two main hospitals that we're at are University Medical Center, which is a safety net hospital in the center of New Orleans. You have a large stroke service there. We've got a general neurology consult and primary service there. Your continuity clinic is there. We have the recently opened Healthy Brain Aging Initiative, which focuses on memory disorders, movement disorders, and memory disorder prevention, which is kind of a novel multidisciplinary clinic. We also have a major presence at East Jefferson Hospital, which is about 10 to 15 minutes into the suburbs. And that has our neuro ICU, as well as a number of our outpatient clinics. We rotate through the VA here as well, where you have a number of outpatient clinics, small inpatient program. We have it is a categorical program. You spend your intern year with the internal medicine program. They have a 4+1 program. Someone previously was talking about the X+Y system. The 4+1 program grew out of the Tulane internal medicine program. And so it's really well developed there. On your +1 week, you spend time with us and our didactics, medicine and their didactics, and then the middle of the week you spend in our clinics, as well as starting early during your intern year in the continuity clinic as well. Then in the main portion, the second, third, and fourth years of the program, you're mostly at University Medical Center in East Jefferson. We have a really strong stroke program, memory disorders. We've got folks in pretty much all the subspecialties that you could look for. We aren't a gigantic program. We've got a fellowship in stroke and neurocritical care. So we don't have fellowships in just about everything, but that means that you get really great one-on-one access to the attendings. There aren't kind of other learners that are at a higher level than you kind of vying for the same attending time that you're vying for. You might kind of feel that as students when you feel like sometimes you're rubbing elbows with the residents trying to get face-to-face time with the attendings. And so I think that getting that kind of direct educational time is really important. Let's see. I'm just looking at one of my slides here. All right. Let's see. I think I really covered all the really important points. But I'll let us move on to the next presenter and towards the Q&A.
Great. Thank you, Dr. Levy. And last but not least, we have Dr. Keenan.
Great. Thank you all for being here. And I see a lot of great questions coming in through the chat. So I will be brief. I'm going to share my screen. I have one slide here to share with you. For a very brief overview, UCLA Neurology is a hybrid advanced and categorical program. We have 9 residents per year, with 6 of those being categorical positions, conducting the internal medicine internship with our internal medicine department at UCLA, and the other 3 advanced positions with a joint internship at all of UCLA Medical Center. One of the strengths of our program is that we are situated in one of the largest academic neurology departments in the country, with over 140 faculty comprising leaders in the field and covering every subspecialty of neurology. We live in a very diverse city, and our residents have the benefit of training at diverse clinical rotation sites. So we have our tertiary academic medical center at UCLA. We also have a VA hospital that we're affiliated with, where we have centers of excellence in movement disorders, epilepsy, as well as MS. And then we also have a location in the Los Angeles County Safety Net Hospital System. That's all of you UCLA Medical Center, one of the sites for our prelim intern year. We have a 4+2 block schedule in our program, again, alluding to that X+Y structure. So you get 4 weeks of inpatient time balanced with 2 weeks of outpatient time where you rotate through electives and subspecialty clinics in addition to your continuity clinic. We also have a house staff union. So our residents here at UCLA are unionized and have amazing benefits, which I won't go into great detail about. We also have what we like to call sort of a choose your own adventure program, where we have a lot of elective time in the PGY 3 and 4 year for our residents to really get a head start on their career paths. We try to promote this through our special interest tracks. So we have a research development track, including an opportunity to apply for the NIH-R25 grant, which our institution is one of the holders of that grant. We also have a clinician educator track, a global health track, as well as an equity, diversity, inclusion, and advocacy track. As with some of the other programs mentioned earlier this evening, we also have a night float system. There's no 24-hour, in-house call in our program. And we also have an academic half-day structure with protected learning time on Wednesday mornings every week, where our residents come together to socialize and learn in a really dynamic environment. I put this slide up here with the QR code to register for our virtual open house, which will be next Thursday, if you're interested in hearing more about our program. But I'd like to just end by talking a little bit about what we're looking for in an applicant. I think that's what you guys really all want to hear. And I'll echo some of the same sentiments as my colleagues here. So we really are looking for people who have a passion for neurology and the neurosciences. We are looking for people who have that drive and motivation to be leaders in neurology. And we're looking for people who are team players, who care about patients, who care about each other, and who can contribute to the culture in our program. So with that, I'll stop sharing and look forward to answering your questions. Thank you.
Thank you, Dr. Keener. We'll go ahead and start our Q&A session. For everyone that's joining us, the attendees, feel free to input any questions, and then we'll just start from the top and go from there. Shannon, you want to go ahead and start with the first one?
Sure. Let me pull the questions up. Okay. And so the first question is, what are you looking for when reading an applicant's personal statement?
I'll go ahead and start, I suppose. Yeah, so I think the personal statement is really an opportunity to take what's in your application and weave it into a narrative and tell us your personal story. So we want to see there, what your motivations are, what your goals are. I think the personal statement is really a wonderful chance to use your voice to really help us get to know you better, and sort of what you're looking for and what's driving you. That's my take.
Yeah, I would just add that I like the personal statement to be different from what I've seen on the application. So make it added value. So not just what don't just tell us the research you did and the accolades you had, because we can see that all in the application. I'd rather hear a personal anecdote of something that happened to you that led to you getting interested in neurology and how that's developed your personality and your drive over time. And that's really what, it excites me when I read personal statements.
When I take a look at them, I'm looking for things that tell me something about you. I see a lot of statements where they spend a lot of time trying to convince me how awesome brains are. I'm a neurologist. I already think brains are awesome. I expect if you're applying to neurology, you should think that they're awesome too. But I want the thing that I'm looking for is, what does it tell me about you? What is there that I can learn from your story and your way of putting yourself together, that I'm not just going to learn from the list of line items on your CV.
I will just briefly echo what everyone else said. I think it's really important to be authentic and tell us what you want us to know about you in your own voice, and not what you think we want to hear or what you think is gonna give you an edge. I think it's really important to hear what you want to do and what you're passionate about. And I also am always a sucker for a good comeback story. So I think if there's obstacles that you've faced as a student, it's really good to see how you've approached those, how you've overcome those. And I always think that's a really nice touch, because that doesn't come through as well just reading it on the rest of your CV.
Thank you. Amanda, if you want to go with the next question.
Absolutely. So the next question is, how does your program view red flags like a failed attempt? Is it a hard screening filter?
Shall we keep the same order? So in our program, we do not screen applications based on USMLE or COMLEX scores. I will say, we do require that you pass eventually, but if you fail and retake the test and pass, that still counts as a pass.
Yeah, it's also not a hard stop for us. We're there may be some filters we apply for certain situations, but that's after we've screened applications in other ways. So otherwise, it's not a hard stop.
Yeah, it's not a hard stop for us. Everything is taken in context. If there's a good reason and a good story and a good comeback, you know, perseverance has its merits too.
Yeah, no hard stops for us. We look at it as part of the holistic picture of you as an applicant overall.
Thank you. Okay, so the next question, I'm going to make it a two-part question, just clump two things together. So the first part is, the person's asking, is there a benefit to applying as a student versus a graduate on the ERAS application? And then the second part of the question is a question that I probably see going to come after this, is if there's a year of graduation cutoff.
So we don't have a year of graduation cutoff. That's easy to answer. With regards to whether or not you're a student or a graduate applying, I think there's not a specific advantage to either circumstance. I think, again, it's just sort of, putting the whole application together and again, sort of creating that story and showing us your career plans and goals and trajectory sort of as part of that story.
Yeah, similar here. We don't, if you're applying as a graduate, there's usually a reason why that's happening, and you're trying to pursue other ventures, which we'll look for. And I mean, those can always be really compelling stories. We aren't always looking for the traditional resident, non-traditional residents. We love those too, and they can be amazing residents. We generally prefer graduation dates less than 5 years. I think we were on our website less than 3, but we're usually screening to up to 5 years. And then obviously for people that are more than that, we take that into account if they have some sort of connection to our program or have contacted us in some way or we know them. So.
All right, so we don't really have a preference in that kind of situation of whether you're a student or a very recent graduate. Obviously, we'd like to know what you're doing for your kind of bit of time in between graduation and when you'd start up in our program. Otherwise, we have kind of a soft 5-year line. But again, everything's contextual. If there's if there's a reason and you've got kind of a non-traditional story and interesting circumstances, we'll take that into account.
Yep, I would say same. We kind of have a soft-ish cutoff of 5 years, but I personally review every single application we get. And so it's just something else that we take into account. I'm not even sure it would dawn on me if it says student versus graduate. I just kind of look at the whole picture. And again, I like to see what you're doing if it's been a bit since you've graduated, like what are you doing with your time? And hopefully doing something that is kind of augmenting your interest in neurology, your exposure. And so I think those can be good things.
For our next question, if a program offers both categorical and advanced positions, is it best to apply to both so we have more chances of matching, even if we would prefer a categorical position?
I'll take this question because I might have the only program with that situation. And the answer is yes, you should apply to both. You know, basically on your rank list, you would just list the categorical program ahead of the advanced program. But unless you'd rather not come here than end up in one of the advanced positions, and I would suggest applying to both. And at least in our program, our advanced positions function very similar to categorical ones in that we have sort of an automatic and joint internship at one of our rotation sites just for GME financial reasons. It's not officially categorical, and you guys don't need to know about why that is a distinction, but yes, I would recommend applying to both, you know, to maximize your chance of getting into the program that you're interested in, and just rank the categorical one on top of the advanced one if that's your preference.
Okay. So the next question is, will you consider applicants without step 1 or step 2 scores at the time of application?
I guess we can start switching up the order now. So I would say not for step 2. We do like to see a pass for step 1 at the time of application. But again, it's not a hard no. For DO applicants, we do not require both USMLE and COMLEX, so we will consider one or the other. So
Yeah, same for us. Typically won't review until we see at least a step 1, and then if step 2 is delayed, we'll look at that later.
Yeah, well, we usually need a step 1 and we really like to see a step 2. I think that if you don't have your step 2 scores in by when applications open, I think that's not ideal. We'll go through and we'll do kind of a second pass through of things later to see if people have added scores later. I think if your step 2 score is missing and the rest of your application is awesome, we'll, we may make an exception, but usually we like to see the step 2 score, even just to make sure that it's in and it's passing. And then we COMLEX is okay as well. You don't need to take step. You just gotta pass a step 1 and a step 2.
Yeah, we like to have a step 1 score, step 2 not required at the time that applications open. And similarly, for DO students, COMLEX is an acceptable first step exam to upload as part of your application.
Thank you. The next question is, there is an increase to 8 signals this year. How will you be using those in your application review?
Yeah, very excited to see. This is the first time for us, as it is for you, seeing how the 8 signals will impact applications this year. I know that there was a lot of discussion amongst the program directors community as to what the right number is and how we could improve upon the utility of the signals from years past where we just had 3. I would encourage all applicants to use all your signals. You know, if you have 8 signals to give 8 signals to your top 8 programs. You know, the signals are intended for us to use in that screening process, not, you know, to later inform our rank list or anything. And I think it will be interesting to see if the increase in number of signals has an impact on the total number of applications that we get, because I think that was part of the goal in increasing the signals, was to, you know, to make it so you don't feel like you have to apply to 40 programs to get an interview, so that you have more opportunities to express your interest to more programs, and sort of have that stand out. So my advice is use your signals, and, you know, we will take that into account as one of those factors as we're performing holistic review of the application in deciding who to offer an interview to.
That's a great summary. I would also add, just ask your home program if they want you to send a signal or not, because sometimes they'll say, no, we're going to interview you already. Don't worry about it. So.
For us, I think for the signals, we're just going to make sure those applications are probably get, I don't want to say a better look, but just we'll make sure that we give them their due scrutiny. We'll make sure we kind of get a sense of if their application gives us a sense of why they're signaling us.
Agree with all, but use them. Can't hurt.
Yeah, don't leave them on the table. Make use of them.
Great. So for our next question, is it important that applicants have an IM letter of recommendation? For example, 4 neurology letters versus 3 neuro letters and 1 IM letter.
I can go ahead and start. I think it's most important to have letters from people who know you best, who can really give a very clear kind of, again, drawing that picture for us, kind of a narrative form of how we can interpret the stuff on the rest of your resume. So I think it's most important for the folks that write your letters to really know you and be able to speak to you and the attributes that you bring to the field and to our program. And we do not have, and some programs do, so you will want to check the websites, but we at Rochester don't have any specific for number of neurology versus IM versus other specialties, or for who writes them, such as department chairs, program directors, but every program is different.
Yeah, so we would, I think at least for us, you know, 3 neuro, 1 IM versus 4 IM. I don't think that makes a huge difference, but I agree. I'd rather have a letter from someone who knows you well, who can tell me about you. I really, you know, if I see a letter from a chairman and it's clear that you rotated with them for half a day in clinic, or you had a half-hour meeting with them, and that's useless to me. I would rather have a letter from, I don't know, OB-GYN, where you worked with an attending for a month, even if it's entirely irrelevant to neurology. It tells me about your work ethic. It tells me about what kind of person you are. It tells me how you interact with your patients. I would so much rather see a really heartfelt letter from anywhere else than, you know, the 4th neuro letter that's just the, or an IM letter just to have it.
Yeah, I would echo all that. You know, I don't really care who it's from. We usually like to see at least one letter that has some neurology in it, or some references to that. Maybe it's not, maybe it's psychiatry and they said, oh, we tried to convince them to psychiatry, but they really wanted neurology. Something that shows us that they know you're passionate about neurology, even if it's not a neurology letter. We like to see some reference to neuro in the letters. If they're all internal medicine, it raises a little bit of a red flag to say, why has nobody mentioned neurology in any of these letters? So.
Yeah, I agree 100%. I think the strongest letters are the ones who are from people who know you well, rather than, trying to get the big name person or necessarily worry about which specialty they're from.
Our next question, how important are geographical preferences? I'm willing to move anywhere. Is it better to say no geographic preference or to put my preferences?
I think this is one thing about the signaling that I like, because you can now put no geographical preference and signal a program to let them know you're interested. Because before, where we are, probably geographic preference is very important to us, and connection to the area is important. So in the past, applicants that had no geographical preference, it was always hard for us to kind of say, well, what does that mean? But I think the signaling is really going to help with that. So if you really like a program and you don't have a huge geographic, signal them. I think that would be helpful. But I think every program has some weight on that. So
Yeah, we certainly take it into account a little bit. New Orleans is kind of a uniquely situated place, and so we want people who are interested in being here. But we are located on the border between two geographic regions, both of which are kind of not as well populated with programs as well as like the Northeast, where you get one geographic region, you've got like 50 programs. So we're kind of in a little bit of an odd place on that. So if we see, a positive geographic preference, that's helpful, but if it's not there, it's not a deal breaker for us.
Yeah, I will echo that as well. We are in a weird we're in the middle Atlantic geographic preference, which puts us with New York City and Philadelphia. Anyone who's been to Rochester knows that we feel more Midwest than Middle Atlantic. So geography is kind of interesting around here. It's one of the things that we look at. It certainly, piques our interest, but it is not a deal breaker if you don't list that. So just keep that in mind, that the geographic preference, depending on the size and the programs, there may be a very different type of style or feel of a program, even though they're in the same, even city.
Yeah, I will just add that I think it's perfectly acceptable to say that you have no geographic preference. There's a place where you can write an explanation for whatever you choose. And to say, I'm, willing to move anywhere. I'm simply looking for a program that, meets these goals, for my training, I think is totally fair. There's also, in addition to the geographic region, you can also indicate your preference for being in a more urban or more rural setting. And so that's another way, another opportunity where you can, even within one geographic region, maybe express your interest in a particular type of setting. As Dr. Tomcik was just alluding to, there can be lots of variability within even one geographic region.
Okay, thank you. So the next question is, do you accept international medical graduates into your program?
Yes.
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 For our next question, I like this question a lot. Have you had any experiences with residents that showed you a new perspective and brought about change?
I mean, pretty much every day. Oh, sorry, Dr. Keener.
No, go ahead. Yeah.
I mean, our residents, I think I learn more from our residents than they ever learn from me. I think they are just incredible examples of resiliency and enthusiasm, and they renew my passion for neurology every day. And our program is really resident centered and very focused on feedback and making changes in real time. And so it's really exciting to kind of see those things play out and then get the residents excited, then I get excited, and then we just get into this really beneficial cycle. So I would say every day the residents smash my expectations.
Yeah, I agree 100%. I was going to say, I think almost the same thing. We really do have a very resident-driven program. Our residents, I think, are the best part of our program and are really the agents of change in our program. So a lot of the things I was highlighting that I think make our program great were ideas that came from the residents. So the special interest tracks grew out of the residents' interest. The 4+2 schedule was a resident-initiated idea. So yes, all day, every day. I think the residents really inspire us. You as residents, are our future colleagues. And I really enjoy collaborating and working with our residents.
Being a new program, this was how I built my program. It was based on residents having innovative ideas and how to change, how to make things better for themselves and for the program. And so yeah, totally agree, echo what everyone else has said.
Yeah, agree with everyone else as well. Our program has gone through a number of major shifts recently, just as the health system is restructured and as we've rebuilt services. And there's a lot of things where we really look to the residents to kind of figure out, as the day-to-day person, what do you want? What are you looking for? As far as the overall structure of the program, we've really been able to, from their feedback, shift around what the core rotations are, what electives look like, shift from, we used to be a very heavily inpatient program. We were like 75-25, and now we're almost 50-50. And a lot of that is based on kind of the push and pull from the residents and what they want and what they need. And I think if your residency program isn't listening to them, what are you doing?
Okay, so with that, we'll go ahead and wrap it up. Just wanted to thank you all for your time and taking time out of your day to spend with us and giving us so much insight, not only about your programs, just insights about the application process and advising almost 60 attendees who are wanting to go through the neurology application cycle. Thank you so much.